Good afternoon, everyone, and welcome to the final day of our 9th annual Symposium on Social Determinants of Health. And it's my pleasure to welcome you. For those of you who are joining us for the first time today, my name is Dr. Lisa Cooper. I'm the director of the Johns Hopkins Urban Health Institute and a Bloomberg Distinguished Professor of Health and Healthcare Equity. We have an exciting program lined up for you today. As we talked about in the previous days of the conference, we're at a crossroads in history, really. In the midst of a global pandemic, there's been a reckoning, America's reckoning with racial injustice, and at no previous time in history has it been more clear to us that health inequities are impacting our society, and we really need to address the social determinants that are leading to these inequities. So I would like to start out by introducing Pastor Gary Dittman, who is pastor of the Amazing Grace Lutheran Church. Pastor Gary has served at the Amazing Grace Church for nearly 12 years. He's been a member of the Urban Health Institute's Community University Coordinating Council for 7 of those years. The congregation is deeply connected to community and responding to neighborhood challenges with community-created solutions and resident leadership. And I was privileged to hear a lot about this from Pastor Gary, and we had a virtual conversation just a couple of days ago, actually, where he really walked me through some of the really exciting work that's going on there. In 2000, we learned that community members, Amazing Grace, and the McElderry Park Community Association established the Charm City Land Trust to create a tool for community to control land use for both preservation and for permanently affordable housing. Since that time, the Charm City Land Trust has been stewarded with 18 lots used for green space, community gardens, a prayer labyrinth, as well as community art. So now I'll turn the program over to Pastor Gary to share more about his inspiring work at the Charm City Land Trust.
Thank you, Dr. Cooper. Thanks so much. Good afternoon, neighbors and friends and colleagues. As Dr. Cooper shared, my name's Gary Dittman, and I am pastor here at Amazing Grace and also part of Charm City Land Trust. And I'm grateful to be here to continue this conversation about health equity and reflecting together about safe, permanently affordable housing as a baseline for thriving communities. Listening to the last 3 days and opening today's conversation on housing justice, it's clear to me that when we talk about building and restoring health in communities with employment and education and food and housing, as Dr. Cooper alluded to, we're actually talking about historical racism and systematic practices that have waged war on Black and Brown communities here in Baltimore. When we look at Baltimore's history with legacy of housing with redlining, restrictive covenants, block busting, and more recently even predatory lending practices, we're not just examining policies, but examining implemented racism where entire neighborhoods are distressed and disinvested in by intentional strategies that are carried out by systems and structures of white supremacy that viewed neighborhood of color as less than. And so while you must organize and undo to implement these unjust practices, the larger challenge of changing communities is not just changing the innate bias and racism, but also creating space and opportunities for underserved, disinvested communities to heal. We've heard that all week. One of the most devastating moments for me in our time together was hearing Dr. Otis Johnson as he described the continued criminalization of Black and Brown communities using school recognition systems as a method of surveillance. So what I've heard is the need not only for innovative practices and a rethinking of policy and investment as we move toward equity, but also I've heard that communities must have safe places where neighbors connect and community cohesion and self-determination can happen. And when it comes to housing, that is a piece of how land trusts work. In a very basic way, land trust is a way for neighborhoods to control land in their communities for the public good. In Charm City Land Trust, that land is used, as Dr. Cooper alluded, for green space, vegetable gardens, pollinator flower gardens, but also as a tool for permanently affordable housing. So we just completed our first house, which we're closing on, and we have a second house now, which is for sale for residents of McKeldry Park with a 30% AMI. That means roughly an income around $31,500. The house is appraised for $180,000. We'll be selling that house at $89,900, meaning there will be a payment, including taxes and insurance, with around $650 to $700 a month. The goal, of course, is to create a pathway for permanently affordable housing for all neighbors. When I first arrived here in McKeldry Park, the average rent was around $600. It's now $1,100 to $1,300 for a house. Not many families can manage that, so houses get split between multiple families. But affordability, community connectedness, and cohesion, this is what we can do as we work together on this land trust, building a neighborhood together, safe for families, safe for children, keeping gentrification and speculative investment, absentee property owners and landlords from displacing long-term residents, and instead letting those residents buy into the neighborhood. The land trust model uses community-controlled development to localize and prioritize the needs and solutions of neighborhoods. So I suggest housing justice looks like employment justice and food access and education opportunities, but it's all tied, as we've shared, undoing systemic racism and creating communities of welcome with diverse opportunities, but also spaces where connectedness and agency can occur. I'd like to turn it back over to Dr. Cooper at this time for the panel discussion.
Thank you, Pastor Dittman. That was just perfect for our topic today. And you tied it all in so well with what we've talked about earlier this week. So thank you for kicking us off. And we're going to just start with some housekeeping items. For those of you who have been with us for the last few days, bear with me. But for those of you who are just joining us, we always like to start first with an acknowledgement of Indigenous and racial inequities. And so on here, we acknowledge that Johns Hopkins University and our schools are on the traditional and contemporary lands of Indigenous peoples, and our campus is on unceded lands of the Piscataway and Susquehanna people. Today, there are more than 7,000 Indigenous peoples in Baltimore City, including members of the Piscataway, Lumbee, and Eastern Band Cherokee. We acknowledge the history of oppression and systemic inequities while representing all tribal nations' sovereignty. We strive to do our own work to address the inequities and disparities Black, Latinx, Indigenous, and Native American people, Asian Americans, and Pacific Islanders, and other persons of color, members of religious minorities, LGBTQIA persons, persons with disabilities, and persons otherwise adversely affected by persistent poverty or inequality experience, while expanding partnerships with and following the leads of these communities. Today is our final day of the Building and Restoring Health in Communities, Understanding and Building Partnerships to Advance Health Equity Symposium. For the past 3 days, we've heard from champions for health equity who have leveraged partnerships across various groups, organizations, communities, and sectors of our society. One of our objectives for hosting this annual symposium is to identify priorities for Baltimore over the next few years to address these social determinants of health. As many of you already know, we developed a program through a series of consultations with residents and community leaders in Baltimore, through discussions with colleagues here at Johns Hopkins, as well as colleges and universities across Baltimore. Through these discussions, we identified this year's theme, Building and Restoring Health in Communities, and we now will go through a few housekeeping items as well as the agenda for today. So the housekeeping items are here again. We are recording this session and it will be shared. The link will be made available later, as will all the other previous sessions. We will have closed captions that will be auto-generated. Please enter your questions for presenters in the Q&A window only. Questions will be answered either live or with short typed responses. Click the thumbs up button if you want to bring a popular question up to the top of the Q&A window. The chat will be made available during the panel discussion for your reflections and open dialogue. But if you have a specific question, please use the Q&A panel only. And we're fortunate to have graphic recording as a reflection tool. So we will have a graphic recorder, Ms. Lauren Green from Dancing with Markers, to capture our key takeaways of the day, as she has done so beautifully for the last 3 days. Next slide. So again, please stay connected to us during the symposium. You may use our taglines, use the taglines of the speakers if you have them, and also use the hashtag SDH2021. So briefly, for those of you who are joining us today for the first time, the mission of Johns Hopkins Urban Health Institute is to advance health and health equity in Baltimore. We do this by facilitating and recognizing collaborations between communities, universities, healthcare delivery systems, government, and the private sector. We do this to build collective capacity for achieving health equity. We also mobilize resources in support of promising strategies. This is by building consultations and strategic partnerships between academia and the government in Baltimore City to achieve substantial gains in the health and well-being of Baltimore residents. And then finally, we advance understanding, dialogue, and trust through programs such as this symposium to create pathways to health, well-being, and social justice in Baltimore. We do all of this with the amazing work and talent of a committed team. So here you can see the photos of our associate directors, many of whom are faculty members in the schools across the university, as well as they serve in our associate director roles. We also have an amazing staff. So I'm going to take just a few minutes right now to thank Dr. Rachel Thornton for her outstanding leadership and vision related to developing the symposium. Also thank Dr. Kendrick Gwynn, who was also involved in helping us to plan and organize the symposium. And then I would be remiss if I didn't thank my wonderful staff, Natalie Wiggins, Program Administrator, Imani West, Communications and Marketing Associate. And last but not least, Ms. Nancy Edwards-Malello, who is our fabulous Program Director, and without whom we couldn't have done any of this. So next, here's our program for today. Following these remarks, we are going to be graced with a musical performance, as we have every day throughout this symposium. We've had artists who have shared their talents with us from various groups throughout Baltimore, as well as through the Peabody Institute. And this sharing of art creates a strong sense of community, bonds us together in our common humanity, and allows us to heal from some of the grief and just the hardships and the sorrows many of us have experienced in the past year. It also gives voice to the voiceless and creates a better society for all of us. So we're blessed to have artists who will grace us. We'll follow that with a panel discussion on safe, healthy, and affordable housing in vibrant communities, investing in housing as a precondition for achieving health equity. And then we'll have Q&A, followed by our graphic recording reflections led by Ms. Lauren Green, and then concluding remarks. So I am going to, let's see if there's anything else I'm supposed to say before I turn it over. We're going to turn it over to the artists, and please relax and enjoy.
Hi, my name is Amanda Dane, and I'm the flute player in the flute and percussion duo, Duo Sela.
Hi, I'm Christina Mansior, and I'm the percussionist.
We're going to be playing 2 pieces for you today. The first piece is called Spiegel im Spiegel by Arvo Pärt.
Arvo Pärt wrote this piece to be sort of a reflective and meditative trance-like piece of music. The title itself translates to mirror in mirror, which I think is really interesting. When you think about looking in a mirror, you see yourself and you see all the different aspects of yourself that you may like or dislike or be indifferent to. And this piece, through very slow phrases and repeated chords, gives the listener an opportunity to do that in a more metaphorical way, to reflect inwardly and look within yourself and sort of just accept all the aspects of who you are as a listener. And I really like that about this piece. When I listen to it, I feel a sense of calm and stillness, and I hope that you experience that as well.
One thing you could do while listening to the Spiegel im Spiegel is practice mindful breathing. As a flute player, I have to take in very quick breaths and then exhale very slowly. And something about this piece you might notice is that the flute has to play very, very long phrases. So I have to be especially mindful of my breathing. If you've ever taken a meditation class or a yoga class and practiced breathing in for maybe 4 counts and out for 8, that is something you could do during this piece.
The second piece you'll hear is Clair de Lune by Claude Debussy. This is an arrangement for flute and vibraphone. It was originally written for piano, and we really like the very delicate and very reflective sound that we get with our 2 instruments.
I love this piece. It's one of my favorite pieces that we play, and one reason I love it is because it sometimes makes me very emotional, even when I'm playing it or listening to it. And in the healing process, it's really important to let yourself experience those emotions, work through them before you can come to a place of peace.
We really hope that you enjoy these 2 pieces and that you find them as reflective and meditative and healing as we do. Thank you so much for listening, and enjoy the rest of your day.
Thank you, Duo Sela, featuring Amanda Dame and Christina Manciora. What a beautiful way to start our symposium this Friday. And to center us for our final discussion, focused on safe, healthy, affordable housing and vibrant communities, and the notion that investing in housing is a necessary and critical precondition for achieving health equity. I am Rachel Thornton. We've met before. I'm the Associate Director of the Johns Hopkins Urban Health Institute. For all of those who I've seen on previous days, welcome back. And to all of those joining us for the first time, so glad you can be here. I'm also an Associate Professor in Pediatrics in the Johns Hopkins School of Medicine and the Bloomberg School of Public Health. And I am beyond thrilled to be moderating today's panel, featuring Adria Crutchfield, the Executive Director for Baltimore Regional Housing Partnership, Sean Klosky, Founding President of Rebuild Metro, and Amy Pekosek, Deputy Chief Counsel in Maryland Legal Aid. I would like for all three of our panelists, starting with Adria and then following on to Sean and Amy, to go ahead and please introduce yourselves. Tell us a bit about your background and the space in which you're working at the intersections of housing justice and health equity. And if you so desire, tell us a little bit more about what brought you to this important work. So Adria, I turn the mic over to you.
Thank you, Rachel. It's great to be with everyone this afternoon. I hope it has been a wonderful week in terms of those of you who have tuned into the symposium each day. So I am Adria Crutchfield, the Executive Director of the Baltimore Regional Housing Partnership. And I would like to say that Rachel is one of our esteemed Board of Directors members. BRHP's mission is to expand housing choices for families with low incomes who have been excluded from housing in well-resourced neighborhoods, helping them access and transition to safe, healthy, and economically vibrant communities. We are creating more equitable communities and futures while building economic power. The organization was founded in 2012, and our role as administrator of what's known as the Baltimore Housing Mobility Program began in 2015. Serving as one of a variety of legal remedies across the country to address the impacts of housing segregation and injustice that Black and low-income families have suffered for generations. The origins of housing mobility programs actually began back in the 60s and 70s in conjunction with the civil rights movement, when Black residents across the country began suing governments to end segregation. Housing mobility programs arose from those lawsuits to provide choice, access, and opportunity to impacted families. And our work at BRHP is the result of one such legal case many of you might be familiar with, Thompson versus HUD. As a subcontractor to the Housing Authority of Baltimore City, we provide $80 million annually in rental assistance utilizing the HUD-funded Housing Choice Voucher Program. And we couple that with housing counseling supports to serve over 4,300 households with average yearly incomes of around $19,000. Those households are comprised of 14,000 individuals, and the majority of whom are children, so they are under the age of 17. With our customized counseling, which are workshops to help folks become what we call lease ready for the private rental market, housing search assistance, as well as unit referrals, BRHP families lease apartments and homes from over 2,200 private owners or property management firms, and are 3 times as likely as other voucher holders in the region to live in low poverty neighborhoods, significantly outperforming the rental market in accessing those neighborhoods. Our program is a proven successful tool to address the decades-long issue of housing injustice. But we totally understand and acknowledge that it takes a comprehensive approach of both meeting the urgent needs of today, as well as place-based community-led efforts, such as some of my esteemed panelists that are leading, like Rebuild Metro, an intentional resource allocation from governments to neighborhoods to help restore and heal communities that have been neglected and to achieve housing justice. We know that people from a community that lack resources, we know that people who are moving or transitioning from a community that lack resources, that doesn't solve the problem of the community long term. And so again, we acknowledge that we need a both and approach of providing families with more opportunities and choice in the short term and community restoration through equitable investment. We also coordinate with community partner organizations like Maryland Legal Aid to add to our repertoire of resources for our clients. Our community partners help to fill in the gaps for that we cannot meet ourselves to better serve our clients. Additionally, we play a role in advocacy, and I'll talk more about that later, both at the local, state, and federal levels related to housing initiatives through supporting organizing efforts, providing testimony at hearings, writing to our elected officials, providing recommendations as well. So that's a summary of the work at the Baltimore Regional Housing Partnership. How I came to this work, I would say mostly through lived experience. Being raised by a single mother, being a product of an interracial relationship in the Midwest in the 80s, and the challenges that brought for both of my parents definitely shaped me, I would say, and then contributed to my own personal values and convictions, invoking a deep empathy for those enduring similar oppression or struggles or just a lack of support. And so that is my motivation, I would say, for doing the work. And then additionally, I have to mention just great educators, teachers along the way in both the public and private school systems, and friends who encouraged and inspired me from pursuing undergrad degree in architecture, and then to working on Capitol Hill, a place I had no concept of as a college student. And then teaching by leading through example, giving me really good examples of strong leadership. So that is what has come to inform my work in this field.
Thank you so much, Adria. I'm going to pass the mic over to you, Sean, to tell us a little bit more about your work. I think you're muted.
Other half of that puzzle of housing and Rebuild Metro, we work in participation with local communities who have been disinvested in, but families that say, this is where I want to be. This is my community. I don't want to leave, but I also don't want it to remain like it is. And from there, we build plans that are based on folks' aspirations and hopes for their families and their neighbors. And what we've been able to do over the last, I guess, probably 10, 15 years is we've been able to invest $120 million into neighborhoods that when we started were essentially 40% abandoned. Places that were exclusively poor or exclusively low income, places where they had no voice about the future of where their community was. And quite frankly, if you think about it, if it's 40% abandoned, the 60% of the people that are living there, they didn't abandon that place, but they are being held accountable for someone else's actions. And we're not sort of thinking that from a social standpoint, that's what's happening. We're also not thinking that 60% of the people are still living there. Right. And what we've been able to do with this money is we've been able to reduce the abandonment by 75%, eliminate it. We've been able to increase the population by 20%. Now, we're not trying to replace house for house because we have to rebalance the market. Baltimore was built for 1 million people and now has 600,000. So we're actually going to try and reduce the total number of housing units by 30%, which would sort of map to where the market wants to be. We've seen, just by doing this alone, we've seen the homicide rate cut in half in the places we are, right? And then we've been able to see a 15% increase in income. And all of this has been done without displacing a single person, because you don't need to displace anybody to build because there's space, as we started with, 40% of it is open. And when all of that happens, the community then begins to feel that they had a voice in the change that they always wanted. And one guy who grew up in the neighborhood, like literally from being a toddler all the way up, he's 35 years old, and he said to me, Sean, this neighborhood isn't as good as it used to be. It's better than it ever was, right? And it's my neighborhood, and I never want to leave it because it's mine, right? So that makes a lot of sense. I think that the second question, like, why do I do this work, or how did I get into it? It really, it started with sort of a faith call that Pastor Wood talked about. But really, it's interesting because you're called mostly in faith positions to issues of injustice, not because of the injustice. Most people are motivated by the charity, right? And then what you see when you begin to step into that space, that you can't give someone a gift in charity if it was already due them that injustice. And I think too often we don't take the step and we don't recognize that the injustice demands action. The charity is up to you to decide whether you want to do it. And really, when you look at the situations that we're talking about in terms of housing, there is a demand that must be met. And it's incumbent upon us, all of us, to recognize that and then take the appropriate actions. Take the gifts that you've been given and say, well, in doing justice, I have to apply them to this situation. I have to stand up for the things I believe in. And then I think lastly, when you do this work, the best part happens, which is you fall in love with the people and the communities you're in, right? Because if it doesn't ultimately manifest itself into a true healthy relationship, where people are working together in solidarity in community, then neither the justice nor charity work.
Thank you, Sean. Amy, over to you.
Yes, good afternoon, everyone. I'm honored to be in the company of such amazing advocates today and very happy to be with you all on behalf of Maryland Legal Aid. Maryland Legal Aid is a nonprofit civil legal law firm, which means that here in Baltimore City and across the state of Maryland, in every jurisdiction, we represent low-income Marylanders who qualify for our services in a range of cases: domestic violence protections, bankruptcy cases, foreclosures, eviction cases, all kinds of consumer, family law, elder law. And so we work in a variety of arenas. Today, really the focus is on our housing work and on the crises that have emerged, especially in light of the COVID-19 pandemic and here in Baltimore City and across the rest of the state. So we have advocates doing active housing work in terms of eviction and foreclosure prevention here in Baltimore City and across the state of Maryland, about 200 advocates doing that work. How I personally got involved and came here to the spot at Maryland Legal Aid. When I was in college, I did a lot of work in Philadelphia alongside the homeless, in Camden, New Jersey, and then in Tijuana, Mexico, and in regions of Appalachia in Kentucky and West Virginia, physically rebuilding homes, and then spent a lot of time listening to community members and understanding policies historically that have led our country to where we were then and where we are today about 20 years later, and really wanted to be able to continue to do that work, to listen to communities, to lift client voices, and I've hopefully been able to do that in my work here at Legal Aid. I spent my first 10 years here representing children in the foster care system and saw so many children and families that poverty and inequities were the root causes of how they ended up where they were and needed a more systemic solution than the Band-Aids they had been getting. And so overall, continue to learn so much from the client population we work with, and their resilience is what continues to drive my work.
Well, thank you all for those great introductions, both to you as individuals and to your organizations. I want to kick it off with a question for everyone, which is, what do we need to do to move the needle on housing justice in ways that leverage evidence-informed best practices to serve everyone who needs them? Economic investment, improved coordination, policy change, scalability, something else? What is it that's missing in this space that's sorely needed?
I'm happy to start if that's all right. I would say we need a couple of things. Investment and action from the federal, state, and local governments for sure. I think we'll have a more robust discussion in just a moment about what some of those actions look like. definitely, I would say, a change in practice. So when it comes to administering the Housing Choice Voucher Program, any current public housing authority or entity that administers the voucher program can easily adopt the practices of BRHP right now. And so they could be administering their voucher program in a way that allows for greater choice for residents, even if they, I would say, don't want to call it a housing mobility program. There are definitely changes in their practices that can make it easier for lower income folks to access well-resourced neighborhoods and have a successful tenancy over a long period of time, providing stability to their families, to their children, which so often low-income families struggle to do. And then I would say HUD too has a role to play and can make some regulatory changes to facilitate allowing housing authorities to do this. And then thirdly, I would mention sharing of the outcomes. I think that's really important. Working with clients to tell their stories, utilizing existing data available to public housing authorities and or HUD, or whatever venue you kind of work in, but leveraging that data to help tell your story. And then establishing partnerships with research institutions to kind of track long-term outcomes. I'm happy to speak to some of those later during the discussion that BRHP has engaged with Johns Hopkins University on. But to basically, give credence to the practice with hardcore studies over the long term. So those are a few things that I would say could help move the needle.
Sean or Amy, jump in. We're all in a meditative state after our musical interlude. So.
Sort of the Zoom, you're not sure if you're supposed to go or not. So I think a couple of things off the top of my head. The BRHP platform, I think, could easily be enhanced by changes to existing state procurement rules in the qualified allocation plan. In New Jersey, years ago when I ran the Housing Finance Agency, we changed 2 citations in the qualified allocation plan, and we flipped the distribution of affordable housing from 70% hitting existing impacted census tracts to 60% hitting communities of high opportunity in 4 years, right? And it's simply sort of changing the scoring. The way in which we're doing housing right now is essentially it's a private market-based delivery of affordable housing. Those providers of that housing are essentially market-driven. They're agnostic to where the houses go. Therefore, we can utilize changes in the qualified allocation plan to ensure that the houses go in the right spot. So I think that you have to have good policy to target, but once you change the targeting, or once you make more appropriate targeting, the system will naturally let the houses flow. I think the point of additional federal resources is spot on, and I think we look at the programmatic revenues or capital being made available to housing over the last 20 years has dropped dramatically. I think that what we've done is we've assumed that housing is to be distributed based on markets, but as a people, all of us, we agree that housing is a fundamental human right. So how are we allocating that which is a right based on market's ability to pay? And then coming off of that, I think that the current lumber shortage is putting into everyone's view that there is a price issue driving, and it's because it's now affecting the middle and upper middle class. People are recognizing that, housing is an expensive thing. Well, for more than 50% of the population, housing has always been a really expensive thing. It just didn't bother the other group, and therefore we were okay with it being market, right? So I think what we have to do is we have to own the fact that there is a complete contradiction between this is a human right and this is a market distribution system, because they do not, they don't level one another.
Yeah, I would echo what both of my colleagues had said, and just add, it's an atypical lawyer answer to say first, but we need to learn, listen, and connect. We need to look at our history of redlining, of predatory lending, to learn from that instead, because we see practices mirroring things that have happened 20, 30, 40, 50 years ago, and that's not going to move the needle. And to constantly check ourselves, even those of us that work in this field, about all of that. We need to listen to client communities and amplify their voices. Just like my colleagues have said, I think that we overlook that step way too often. And we need to connect with each other. As a legal firm operating in the nonprofit space, I'm continuously shocked by those of us in this space that don't connect with each other, that aren't aware of the resources that we each have and the pieces that we can use to complement the work that we each do professionally in this field. And I think that connection can be a missing link often. And then my lawyer answer is we need to fight. There are bad actors. There are bad landlord actors that my attorneys see in court here in Maryland, here in Baltimore City every day, and they need to be taken down. It's not acceptable. Housing is a human right, and they absolutely need to be called out in court, in the media, in the public, so that it's not an acceptable action any longer to treat individuals the way that many tenants are treated.
Thank you all. I'm going to take executive privilege here as the moderator because I see one of my colleagues, Letish Walker, who's one of our community health workers in Johns Hopkins, putting a question that I think many of us struggle with when we know that housing access is a concern. And I don't want to put any organization on the spot about this, but could you all, Letish is asking about, the fact that so many people are in need of housing and that the supply constraints are really something that creates a lot of difficulties in finding a way to respond to those needs. Can you guys maybe drill in a little bit more, either if as it relates to current opportunities on the horizon from a housing justice perspective at the local, at the federal level that people can really advocate around? Where are those opportunities to realize housing as a human right through creating access to supply in a way that makes it possible for people to take advantage of programs or to have programs that can actually fully realize their mission of wanting to serve every single person who needs safe, affordable, healthy housing?
Well, I really appreciate that question. And by example, there are 14,000 households, that's not even individuals, but 14,000 households on BRHP's wait list for voucher assistance. I think one thing to be hopeful for and to work with Congress to get done is Biden's plan to significantly expand the Housing Choice Voucher Program. And while, yes, I think when I hear the term supply, we're usually thinking of hard units, and Sean can definitely speak to that. We have to make sure that someone can then afford the rents at those hard units. And so I think it's, again, you got to work these issues from both ends. And BRHP's program has been very successful in leveraging that supply that actually does exist in high opportunity areas by working really closely with the clients to get them ready to rent on the private market. So while for sure, I think you have to consistently be supporting the development of affordable housing and honestly of just housing period, supporting greater density generally. There are, again, practices, changes we can make in our current programs and policy areas we can advocate for, such as the expansion of the Housing Choice Voucher Program, so that we are ensuring it serves all of those who are eligible once those units then come to fruition.
And just to be clear, Housing Choice Voucher Program is more or less analogous with Section 8. Is that right, Adria? I just know some of the terminology may be unfamiliar to our listening audience here. Great. Sean, I think you were about to chime in.
I was going to say, I think that, again, this is easy to follow you because you're always right, and then I just sort of add. It looks like the federal legislation that already came out, the Recovery Act, has hundreds of millions of dollars that can be used for housing. That's one, and that's just for Baltimore. It's not, I mean, this is a national problem. So every state has access to that. And I think and if we were to get an infrastructure bill that's of even half the magnitude that's being bandied about, I think that there would be real housing funds there too. But I don't think that that's the right way to approach it, sort of waiting for the federal government to act and they are solely responsible. I think the states can look at their both their bonding capacity and their budgetary line items and ask the question, am I treating this like it's a priority? Because all of my citizens need affordable housing. And what we've done is when we define affordable housing, we're totally fine with someone in a substandard house that they can afford. Well, having substandard housing is not affordable housing, right? That is not justice. That's just like, I don't care, and you went away and you lived over there, and that didn't bother me. We really have to say that's wrong. We have to build safe, decent, affordable housing. So that's two. Number three is the cities can do this, right? The city of Baltimore can look at its bonding capacity and say, how many housing units do I need to do? If each of those three legs of the stool were to fire at the same time, and I think you have a moment in history that could potentially happen, it's not like you're buying a non-capital good. These goods, once you build these houses, the houses that Rebuild is rebuilding right now, they were built 100 years ago. You make a major investment to ensure that the housing market works again for all people, not some people. And you can do it over a decade and resolve the vast majority of the issues.
And I think in the meantime, while we wait for the federal money, while we wait for the hopeful changes in policy on that level to trickle down, we have to look at other ancillary remedies, legally at least, that can be put in place. For example, the McKinney-Vento, a federal act that allows families and children to remain in their home school even if their housing is not there right now. So if they are temporarily homeless, if they're couch surfing, they can be, under federal law, kept in their same home school. That provides a level of stability for the family while we work on the ancillary issues. And so I think I could go on about lots of different legal protections in that way. I don't think we access those often enough for the clients we serve.
I want to move us on partially to something that I know Amy mentioned earlier. So this will be a specific question to you, Amy, and then I'm cognizant that we got a bunch of questions in advance from the audience, which I'm reviewing now, and to please invite people to keep the questions coming. But Amy, you alluded to this a little bit in the context of the current COVID-19 crisis, and specifically the recent development around the eviction moratorium. Talk to us a little bit more about the issues that are arising right now for families with respect to this.
Sure. So just historically over the past year, we at Maryland Legal Aid, as many of our partners in the nonprofit sphere have just seen a tremendous increase in the amount of clients that are eligible for our service. Many that had identified as middle class before are now identifying as low income and are therefore facing possible eviction. To try and remedy that, as part of the original CARES Act legislation, Congress authorized an eviction moratorium, meaning a freeze on the ability of landlords to say, get out under a failure to pay rent. So because you didn't pay, you're evicted. They stopped that for 120 days. Once that expired, the CDC got involved, which is not usual for a public health agency to be issuing a stop on a legal process such as eviction. But under the Public Service Health Act, because of what we all recognize as those who work in the field of the extreme health implications of an eviction, especially during a national pandemic, the CDC issued a national moratorium that has been extended a few times. Currently, that is set to expire on June 30th of 2021. Now, even with that in place, as we started to get through January and February of this current year, we at Legal Aid and our partners across the country started to see landlords finding ways around it and various court systems and judges allowing those ways to succeed. So whether it be through a tenant holding over, a breach of lease case, we were seeing warrants of restitution that were issued, we were seeing evictions that were being allowed to proceed despite the CDC moratoria. As in Maryland, courts have now opened fully again. They were restricted access for a long time. As courts open fully, we're seeing extended failure to pay rent dockets in district court. And our advocates every day are having to get really creative with their advocacy to find ways to still argue that CDC moratoria applies to our clients. As that is continuing to happen this week, as Dr. Thornton just indicated, there was an additional development in that a federal court issued an order saying that the CDC moratorium should not remain in place anymore. I won't get into all the legal reasons for that, but it basically said it's no good. So as a response to that, the Department of Justice filed an immediate appeal saying, whoa, you're wrong, the CDC should stay in place, and they issued a stay. That stay was granted. A stay in a legal case doesn't mean a judge has decided that either party is right. It just means everybody hold up. And while you're holding up, everybody work on your arguments and come back later. And while you're holding up, we will keep everything frozen like it was, which is good for the clients that Maryland Legal Aid represents right now, because that means the CDC eviction moratorium, scheduled to be in place through June 30th now, is still in place. I will tell you, in the about 6 hours that it took to get the original order this week that the CDC moratorium was no good any longer, from the time the stay was put in place, we heard from our advocates all over the state that were in court in real time, that judges had gotten notice of it and were ready to possibly change their actions based on the fact that the moratorium was lifted. We're ready to hear different arguments now. Failure to pay rent cases, things are changing. It turns out the CDC order is not in place. So that's how quickly things might change. And just to briefly end by giving you the landscape here, 20% of renters across the nation, that's 1 in 5 individuals that rent, are behind on payments. That's $57.3 billion that's estimated, that's owed right now in back rent. And there's potentially 40 million people that could be facing immediate eviction if this order is lifted. Because everything that I just spoke about, nothing forgave rent being owed. Nothing said you don't have to pay. It just delayed when the payment was due. It also allowed landlords to continue to seek interest or fees or fines or penalties on top of late payments already owed. And so the amount that is owed just keeps growing. The number of individuals at risk also keeps growing. The pandemic has not ended. Although vaccines have helped, we are still in the state where not everyone is back to the same level of employment that they were at before. Many students are still learning virtually, parents are out of work. And so we have people who still are not in a position where they were even before the pandemic. So it's sort of what it looks like right now. And rest assured, evictions are still happening and still need tremendous advocacy in court right now. Because once someone is evicted, not only is their family put in crisis, their belongings are often put out on the street, they have to find an entire new support system for themselves and their minor children. That's on their record forever. And so the next time they look to find housing, someone's going to say, oh, you didn't pay your rent the last time. And so we're creating a cycle that is going to go on for generations. And so that's what the crisis looks like right now. And that's why you hear so much about money being pumped down federally into eviction prevention for the tsunami of cases that we are seeing now and will continue to see.
Thanks, Amy. Sean, go ahead, and then I'm going to switch gears
to this. Amy, I agree with everything you're saying. I just want to add to the complexity of when you set a housing system up wrong, you end up with a set of unintended consequences that's driving this. So when you set a housing system up that's basically saying, well, we're going to let the private market handle most of our affordable housing, and they go out and get loans, and that money that was not collected in rent becomes due in a loan. Well, now you've put the landlord in the middle of a rock and a hard place, because we haven't done our public due diligence of ensuring that either the bank has a stay on its collection of the mortgage from the landlord, right? Or we haven't said, do we have the right pathway to get money around to support the tenant that can't pay, to the landlord, back to the bank, right? But so you just end up with a narrative that's like, oh, this group of people can't pay, they have to leave. Well, that's not the whole story. This entire society chose to set up a financial structure up that was wobbly, and when it got hit with a pandemic, the entire system collapsed. And then we're pointing on who the bad guy is, when in fact it was actually a structural problem, or a lot of this is structural. I think there are plenty of bad actors, but there's an awful lot of bad structure.
Thanks for that. Adria, I want to make sure we do this in our discussion as now, just because I know this is something that in our prep meetings that was important to every one of you, which is how do we amplify the voices of the clients that you all work with, of the communities, whether that's in your case through within the context of program administration and policy development to achieve universal access to affordable housing. You know, it seems like that client voice is just such an integral component. And talk a little bit about how you do that at BRHP and the role of the client experience in sharing your story.
Absolutely. So I think you amplify client stories by cultivating or bringing out their agency within the decision-making process. We have client representation on our board of directors. We have since our founding, and we have recently formed a 12-member client advisory board to give feedback around program changes that they might think are needed, as well as weigh in on some of the policy development that we are thinking through. So those are two very concrete ways that we have included clients. Additionally, we are constantly providing our client leaders with access to information at the local, state, and federal issues that impact their lives, such as this eviction moratorium. We sent a blast out actually to our wait list applicants recently because we know that they are probably most at risk of eviction, and ensuring that they knew that the stay had been ordered that Amy just referenced. Additionally, a few weeks ago, actually, we invited a couple of our client advisory board members into a meeting with an elected official. Senator Ben Cardin graced us with his presence, and we had a really engaging discussion, and our clients shared their stories with him firsthand. And so I think in order to amplify client stories, you have to hear from them directly. We also send out surveys to our clients and you know, have an open line of communication and a variety of communication methods to stay in touch with them. Would it be okay if I shared some client feedback?
Absolutely.
Wonderful. So one of our client board members is a woman named Zelda Talley. And she resides in Howard County and has expressed that her son continues to excel in Howard County schools. He was accepted into an engineering program in the local high school, and he's currently in gifted and talented classes, and he loves it. He has a diverse group of friends that he's able to engage with, and he had started off attending Howard County Head Start when he was younger. And she, as a parent, has been able to get connected with so many resources in Howard County. She also mentions having really positive interactions, for example, with the school principal when an issue arose with one of her son's classes. So that's a little bit of feedback as by example of what clients say themselves. I'm just relaying it to you, but these are their words.
And I feel like I'm putting you a little on the spot here, Sean, but I think, thank you for that, Adria. In addition, I would love for you to talk about the community voices and the partnerships within the context of the work that Rebuild is doing and how you value that, how you give voice to that. I think I'm seeing a lot of our pre-questions and other things that I would love to get to, but I'd love for you to take the opportunity to talk with us a little bit about that community perspective and how you give voice to that in your work.
Rebuild came out of community organizing, so the neighborhood's perspective isn't sort of Rebuild Metro hand in glove with the community. It's really fingers on a hand. Like you can't disassociate with the two. When we do planning, it starts in partnership with the community. The community does planning. When we do fundraising, the community does fundraising. When we select engineers and general contractors and development partners, the community selects them. And it's really interesting, the broader set of opportunities through the entire redevelopment process community members are in, the greater their ability to, one, stand up at meetings like with Senator Cardin, where our folks are out there saying, absolutely, I'll take that meeting. I can tell them all about affordable housing. I can tell about more. I can tell, and the level of both power that then is invested into the individual and agency that that individual has to be an effective partner. To say, hey, wait a second, we shouldn't do that because strategically, remember in the last meeting we did this. Right now, you have a much more dynamic solution than if it's 5 people that are the brain trust telling everybody what you're doing. So I think that and this all this credit goes to Bill, the community of Baltimoreans United Leadership Development. They're the ones that take the time sending people to leadership development training, making sure the community residents understand the dynamics of power, and that power is not a bad thing. The power is like anything else, and if it's used properly, it is really a good thing. And it makes sure that a community, a neighborhood, a geography gets what it deserves. So I think you have to start there. You have to do the hard work of community organizing that Bill does, and then bring that together with development, and you get a very different answer than what normally happens.
Thank you. I also want us to take just a minute to connect the dots. I connect these dots from the perspective of pediatrician, public health researcher, and you all are connecting these dots from the perspective of, community development, housing affordability, housing advocacy. But talk from your perspective about where you really see those connections between housing and health, and how that manifests either for your clients, for your communities, in the work you do. And I know that some of you also have taken on specific work in the context of the pandemic related to that. So if that seems like something relevant as well, I would love for you to talk to our audience about that a little bit more, because I think sometimes, we're coming from one place and people may have a different general awareness of those connections. Whoever wants to kick us off.
Well, in my opening remarks, I mentioned we've had longstanding research partnerships with folks from JHU, and one of those is around an asthma study. And so JHU is looking at the connection between how asthma is manifesting and whether those symptoms are increasing, decreasing over time amongst a sampling of our families who have utilized our program and made a transition out of a high poverty neighborhood to a low poverty neighborhood. And so that is a very clear link while those between health and housing, and while those results aren't yet final and published and the study is ongoing, the preliminary information looks to be really good in terms of how making a move to a healthier environment impacted a child's asthma condition over time. So that's one small example. Happy to share more after my other panelists share.
I would just share that we also at Legal Aid have done a number of recent partnerships, one with Hopkins also working on smoking cessation, and the effect that legal issues, including pending evictions, and the stress that places on individuals, and the percentage at which that then leads individuals to choose options such as smoking or less sleep at night or more binge drinking, or unfortunately sometimes abuse and neglect of children. And clients feel forced into those unhealthy choices because of the stress of their legal issues. And so at clinics in our community lawyering team, such as Lawyer in the libraries here in Baltimore City, we've started to place doctors in partnerships with medical institutions right alongside attorneys to allow for health screening and legal checkups and legal wellness checks at the same time, realizing that clients who are able to remedy those issues feel less stress immediately about being able to access things like a roof over their head and access to food, and then that will allow them to feel healthier overall and to access healthier options. And so we're starting to further explore those partnerships and see those connections all the time. Anecdotally, someone walked out of a clinic recently and said, I feel 30 pounds lighter now, knowing that legal issue had been resolved. And just thinking how many people are walking around out there not understanding that there is a possible legal advocacy remedy to their problem, and how in the housing context that health issue creates such a high level of stress and unfortunate outcomes.
I would agree with both points, especially on the stress and anxiety and how that affects folks in distressed neighborhoods, or neighborhoods that start distressed and then they get healthy, what you're seeing is you're eliminating major sources of anxiety. Blight and abandoned houses, if you monitor folks' blood pressure as they walk by that abandoned house, it goes up, right? This is not a normal environment that a human being needs to be in. It is a stressor. By eliminating that, it reduces that stress. By creating affordable housing that people don't have to worry about, it creates family stability. That's also fantastic. By taking all the lead-based paint dust and all of the rodents that are in the abandoned houses and getting rid of the abandoned houses, all of that stuff is eliminated, which again gets into the asthma issues of why we're having problems in certain neighborhoods. I think when you remove all those things, that's step A. And step B, as we found at Rebuild Metro, is sort of asking what makes a community resilient. So when you have a pandemic, why does this neighborhood and this group of people sort of migrate through that pandemic differently? And what we saw in our community last year and all the way through this year is one of the local businesses went into hand sanitizer production when there was no hand sanitizer. So our community, we had given out 2,500 families 4 bottles of hand sanitizer by the first week of May. We were able to get them masks because one of the local businesses converted their bag sewing shop into a mask shop. So that went out. We then engaged with some folks up at Hopkins when we heard from our apartments that there was no food in the apartments. Hopkins helped launch what looked like a pilot program that was supposed to be for about 6 weeks. It's still going. We used the churches as the distribution center, and because of the hand sanitizer place was a brewery, they had connections to the food distribution networks, the regional food distribution networks, and they mentioned to us the food distributors, they had all these empty trucks and all this excess capacity, and we had all these people that were hungry. When we mapped them together, what we were able to do is bring tractor trailers of food to churches, and rather than having food at those churches, we then created 10-car distribution networks where we used cars to drop the food to individual houses. This week we did close to 1,500 families. During the year and a half, we're up to 4 million meals, all because the community sort of said, this is what we need. And the community looked inside its own resources and was able to provide that. Again, you have to network it. You have to have BUILD, Baltimoreans United Leadership Development, their sort of community network to overlay and connect people, but it's there. And that's really a powerful tool that changes the health outcomes for folks.
I think that really ties into sort of a theme that I'm seeing in some of the pre-submitted questions and in a couple of the questions in the Q&A. So I'm going to try and weave a few things together here and get everyone's different perspectives, which is this idea of agency and capacity among people who sometimes are perceived as unwilling or unable, in a disparaging light in terms of their potential, whether it relates to home ownership or integrating into communities. I would call the question on that, but I think we've gotten a couple questions here that relate to empowering families and their ability to, make a move if that's what they really want in a new community. There are several questions here about the types of supports that might be afforded or needed for families to really support children in achievement success in a new school environment. I would turn that around as well and say, what is it about the school environments, which we had a whole day on Tuesday that may be part of that recipe, say for BRHP or other programs that are really looking at opportunity where people move. And then there are some great questions, including some personal examples in the Q&A around home ownership. So maybe we can just take in a conversational way those issues around client empowerment, around skill development, around economic empowerment. And, I happen to know some of the things you all are doing in that space, but let's just have a conversation about those topics and how they weave together.
That's a lot to digest. I'm trying to think of where to start.
Well, let's start with home ownership. There's people asking about the distinction between supporting affordable rental units and empowering people in the purchase of their first home.
Sure. So I do believe that both are necessary to the extent that, as Sean has pointed out many times, we continue to rely on this market-driven housing system where housing is viewed as a commodity instead of a basic need. And so, you know, I would advocate for policies and solutions that further both. I absolutely believe folks of low income or who are earning, you know, not a living wage can be homeowners. I think that might require additional subsidy, but I do believe that that's a worthwhile investment in terms of, again, creating a stable housing situation for a family over a long period of time, as well as allowing that family to build some kind of equity and use that equity just like any other family might need to tap into that equity for an emergency situation, to help a family member, to send their kid to college, those types of things. And so I would say, you know, yes, we need the creation of more affordable rental units. And yes, we absolutely also can provide home ownership opportunities at lower thresholds. A lot of times the biggest piece or barrier, I would say, to the homeownership generally is the down payment that is needed up front. And then if the mortgage product is a good one, then that monthly payment operates very similarly to rent. I do think it's important to think through the economic resiliency of a family and to really prepare families for weathering those economic storms who don't have as many means or don't have family networks with extended means. And so I do think, you know, there's a need to do some kind of preparation for setting folks up for success, right? But I absolutely do believe that both of those things are necessary. I don't think they're at odds with one another. I think you need both.
Can I say that I think we need to start sending the message that we value homeownership no matter how high or low your income is. And I don't think that's the message that we're sending across the board right now. When you can lose your home to a tangled title, when there's estate issues, when there's a tax sale pending, and someone who can pay the $750 water bill doesn't have a problem, but someone who can't might lose their home for generations to come. I don't think we're valuing home ownership for low income individuals through all of those different policies. And until we start doing that across the board, I think we're going to continue to see the same inequities in home ownership.
Yeah, and I think if you look at the data following the Great Recession, what you're seeing, especially in Baltimore, is there has been a dramatic reduction in Black home ownership post versus pre-recession. And I think one is sort of the access to mortgage products. Another one is if you look at, say, a program like the home program, it had historically focused on creating a sort of a balance between rental and home ownership. And one, it's been drastically reduced. And this is a subsidy program ensuring that low and moderate income homeowners are getting mortgages at 30% of their monthly income. So if your monthly income could afford $600, that's what your mortgage will be, right? Because they're going to pay the difference in the purchase price. It's soft second zero interest mortgage, but it's still, you know, gets you there. When that program went through the Great Recession, there was a change that basically said houses that weren't sold after 90 days automatically became rental houses. So that meant that if it was taking people a while to buy a house and it was taking them more than this amount of time, that house ceased to be a for sale house and it became converted to rental. We don't have, again, it goes back to the affordability and the way in which the capital is structured. we don't have a vehicle that is robust enough to get to homeownership. I think Senator Cardin has signed on to a bill in Washington. It's a tax credit for homeownership, which would rectify that. And there's a reasonably it's a bill that has bipartisan support. So there's a hope that that tax credit would be available. But again, doing it as a tax credit, that's a totally different policy issue. But the idea is we've got to get affordable housing to be affordable as a right, whether that's homeownership or rental housing.
And there are several kind of combined questions in here around some of the practices and skills, either in the case of a landlord who's willing to create a sort of approach to paying the rent that works well for someone on a fixed or tight income, or whether that has to do with any kind of education or skill building or other types of opportunities that allow people to work on saving and budgeting. I think there's a question from Latish in the Q&A that incorporates some examples of that. And then we got some previous questions around what it takes to help prepare people, to meet some of those economic or financial requirements as well. Does anyone have anything else to say about those kinds of programs? And potentially, I think we also have a lot of questions from the previously submitted that have to do with evidence of return on investment or evidence of sort of benefit of investing in these kinds of programs for people. What is the research? What does the evidence tell us about programs that couple, access to affordable housing with anything related to building skills?
I can speak to that last part first, and then I do want to go back to thinking about how we're preparing folks. Really what I call it is like preparing folks to navigate this capitalist matrix, which is really oppressive. I do think we need to your point, need to reframe the conversations and think of like, why should the clients have to navigate this matrix? Why can't the matrix be changed? So we are doing a lot of work towards that, but it's not because the client themselves is deficient in some way. It's because our system is so incredibly hard to maneuver through, especially when the playing field is so uneven. But first, to the point around the kind of evidence-based, I would recommend folks look into Raj Chetty's research around the CMTO project out in Seattle, Washington, King County. So he's done random control trials related to a housing mobility program that they launched a couple of years ago. And they're seeing really good outcomes for particularly the children, but also the head of households. Like, again, to just go back to the health and housing connection, the level of stress that is immediately alleviated when you address someone's housing need. And again, that's typically coming from the problem of not having enough income coming in, or not making enough wages, or not having access to jobs, right? There are a lot of factors that lead to that inability to afford the housing markets. But when you alleviate that burden, the stress levels of the heads of households go down tremendously, and they are better able to tend to all kinds of other things. And I think that's a very easy thing to understand. I don't think you need data to even support that. Just imagine yourself under the crushing weight of not being able to pay your bills, and not being able to keep a roof over your head, and to keep your kids in schools. And sometimes I think we make these problems so academic when really they are not. But I would point to Raj Chetty's work. Additionally, he has demonstrated that the investment that we place through, for instance, the Housing Choice Voucher Program, so assisting a family and helping a kid leave this cycle of poverty, he has demonstrated that their lifetime earnings, increases to the point of which of the value of the subsidy in the first place, right? So if you're providing stable housing for children on the front end, their lifetime earnings are going to increase, and all the way to the point of being able to cover that subsidy in the first place. Poverty costs money. It is beyond me why we don't understand that at this point. So better to invest on the front end, better to invest in terms of ensuring someone's economic wellness, their health wellness, ensuring that they're able to attain a great education, ensuring that they are able to access jobs that pay living wages on the front end. And then you don't have this back end need to navigate the matrix. So I'll stop there.
Everyone's awake now. Sean, chime in.
Yeah, no, I just thought that was great. I was going to say, in terms of redevelopment, the numbers kind of speak for themselves. We put into the neighborhood. Again, you're not displacing anybody. We made $33 million of investment in one neighborhood and saw housing prices rise 500%. Right, so you're saying there are about 400 units there. You start out with a price that was around 11 grand. Now it's $72,000. Just do the math, and you're getting the return. You still have the $33 million because you still own the buildings, right? So you put it in there, and the market essentially went back up. Now that family that had a house that was only worth $11,000 has a house that's worth $72,000. That's a pretty good way to get income and wealth onto someone's balance sheet if they did that. One of the things that we have been doing really deliberately in Johnson Square with our work is ensuring that folks don't then lose that house due to either tax foreclosure, some of these, a water or sewer lien, and more importantly, aren't responding to mailers where we buy houses, right? Where someone, as the market's going up, we're now stripping the wealth from somebody else in a predatory way. So there are a lot of things that you have to do. And the other market, we saw similar effects. We saw it go from about 18 to about 130 at median prices. So there's a distribution there. But again, that's about 6 times increase. And the idea is, if you're getting those types of outcomes, and you're seeing homicide rates drop, and you're seeing fires and board ups and all of the things that nobody wants to see in the neighborhood disappear, it doesn't matter that Baltimore's local government is overtaxed, so you didn't actually shrink the number of people working for the municipality because you produced the problem. They just went to some other community that was being underserved. But that savings actually still occurs, right? So you now have more resources to apply someplace else in what is a resource deficient system, not in a pejorative way, just a factual way. They have more work than they have people.
I would just add that from a legal perspective, we started 5 years ago here in Baltimore and then statewide our community lawyering initiative to actually go into communities to provide legal services on site and then to listen to systemic problems and help communities work together to find solutions, whether that be transportation issues, environmental justice issues, and those really directly correlate back to the broader lens of home ownership and communities, of communities taking back their own power and their own voice.
Thank you, guys. We're starting to round that corner towards the end of our time together. And I think one of the issues that I'm seeing, which I would actually like to take a step back from the questions. We got a series of questions about evidence regarding whether or not investing in eviction prevention or in mobility yields a healthcare return on investment. As opposed to answering that question, which, some of you may, like from our earlier discussion about housing as a right, may question the premise that is the ultimate value. I would almost rather pose to you to just reflect to us from where you sit in housing policy and in your work. Your response to this notion in healthcare that the imperative for housing has anything to do with whether or not access to healthy, affordable housing produces a healthcare return on investment. Is there anything wrong or right with the conversation in the healthcare community having this kind of focus on justifying housing investments based on the extent to which they optimize healthcare costs? So I'm going to pose it that way. I think we had one about the best method for calculating ROI. We had another question about specifically what is the ROI when you're investing in eviction prevention to healthcare providers. And there were a few others, but I would, if you want to answer those, I'm more than happy for you to do so. But I would also, since we have a healthcare audience here, be interested from where you sit in your perspective on this idea that housing investment is somehow made more justifiable because it yields a return on investment in healthcare.
Yeah, my sense is it does. I'm not sure if I would. I mean, I get this audience. That's what you're thinking about, because I do believe it's a right. We spend an awful lot of time, despite that, sort of doing the statistics I've done to describe that it has market impact. I think that the most obvious ones are families that are in safe, affordable housing are likely to be a much more stable group. They are much less, especially if they're in stable neighborhoods with healthy social networks. They are much more resilient. They are much more capable of dealing with the stresses and anxieties. They have better ability to utilize those networks to navigate whether or not it's a chronic illness, sort of an environmental like illness like asthma, or if they just break their leg, right? And instead of going back to an apartment or a house where the heat doesn't work and the steps are broken, you don't have any of those things. I think that the housing is one of those things that creates a condition where you can be healthy and you can remain healthy, or if you're not healthy, you can get better much quicker. And that's why you keep people in the hospital, right? It's because under our care, you're going to do better, right? Versus if we send you, we give people operator and they just send the gurney out to the parking lot. No one does that. You send people to environments that work, environments that are conditioned properly, that are clean and sustainable. And that's what we're saying is good housing is that environment, and it will improve health outcomes. From my standpoint.
And then, Adria, I think you may be responding in the chat. There's a specific question of interest about the nature of BRHP's client advisory board. And there's a related question that we got submitted before this panel about who is missing from the table more generally in discussion of next steps for Baltimore. This was specifically for Baltimore to lead as a regional model, I think, of establishing healthy and equitable access to housing. So maybe Adria, you could start a little bit with the philosophy behind the client advisory board from BRHP's perspective. And I would love to have everyone kind of conclude today with a discussion of who should be at the table, who's not, and your ideas around action-oriented next steps from this dialogue.
So yes, I did respond in writing to that question around the client advisory board. But again, this is an opportunity for the BRHP team, staff, and to some degree board members. But again, we do have client representation on the board to receive feedback in real time. And directly from the clients. So I had mentioned, we survey clients and we do interact. We have a high level of communication with our clients. Through our website, through our email communications, through the phone, through our intentional counseling work. But again, the idea is for folks to be able to share their ideas with us around what improvements could be made to the program and their ideas for, what additional resources would be helpful. Just again, to go back to the home ownership piece, we do have a ton of clients who are who have expressed interest in becoming homeowners. And so as we think about how to serve our clients in a deeper way, that is something that, you know, we wouldn't know otherwise unless they were the ones kind of advocating for that. And so we have thought through an asset building program to potentially assist them in that path towards homeownership. We're creating that as a result of trying to meet that need that was raised by our clients. I also look at the client advisory board as an opportunity or preparatory pipeline is what I called it in the chat for board of director membership. And again, I think I heard Sean mention they have a leadership academy, leadership development academy. And I do think while absolutely a client doesn't need anything in order to share, you know, their story and their experience, I think they can benefit from understanding the dynamics in which we are operating, what those restrictions are, what those hurdles are, as well as just like group dynamics and being able to feel confident in speaking, perhaps in a way that is not the way that perhaps other board members speak, for example. And so I look at this client advisory board being a training ground almost, so that folks then are ready to come serve on the board of directors and feel confident in wielding that power, as Sean mentioned earlier.
In response to your question about wrapping up and mentioning who might be missing from the table here today, I just, one thing that comes to mind is the real strong importance of our mental health professionals, social workers, those in the communities that are bringing a trauma-informed perspective, are supporting our clients as they navigate evictions, as they navigate homeownership for the first time, as they navigate years and years of policies that by no fault of their own have put them in the place where they are. I think that wrapping those professionals into solutions and into day-to-day challenges that our clients are facing is going to get better healthcare return on investment for everyone.
I think it probably, given in light of what I've said about markets, again, we use them, but if we're talking about this as a right, it does strike me to be an opportunity to talk about to elected officials and existing government officials. Say, hey, listen, this is clearly not happening. Either the laws are not being effectively enforced, which is the appointed official, or we don't have the right laws to provide the things that we need. It strikes me as that might be helpful. But again, through a health lens, I'm not sure if that's where you want to go.
Well, I know that we are at our time, and I think that Lauren at Dancing with Markers is preparing to share with us a graphical representation of today's conversation. I first just want to thank Adria, Sean, Amy for taking time out of your day-to-day work to share your knowledge and expertise with us today. I want to thank everyone who stuck with us through 4 intense days of art and reflection. And also just that I think in many ways today was a culmination of some themes that cut across, whether it's racial justice or justice in general, and reframing things from the perspective of how systems can change versus from the perspective of how people can adapt to systems that aren't working. We touched on a lot of things today that for me really resonated, and I just want to tell our panelists, our organizers, our audience, everyone, thank you.
Thank you so much. So you're looking at a time lapse of live note-taking, live visual note-taking. And as you're seeing the ideas and thoughts shared come up on the screen, I want you to think about what is one key takeaway, your biggest aha moment or key takeaway that you had in this experience today. And go ahead and put it in the chat. Go ahead and put it in the actual chat, not the Q&A. What is one key takeaway that you're coming away with or you're going to carry forward from this conversation? I know the resolution's not totally amazing, but you will get the final version at the end. Thank you. Housing and health are inseparable. Thank you. And as I'll do another quick pan and scan, but hand it back over to Dr. Cooper for closing thoughts and remarks.
Thank you. Thank you, Lauren, for capturing our conversation again. Actually, for capturing our conversation over the past 4 days so beautifully with your artwork. And as I mentioned before, we'll be sharing these graphics with everyone who attended. So take a look out for that. And we have it's been a pleasure to be with all of you. We've highlighted some really important and impressive work being done in Baltimore, as well as throughout the region. And it's really important that you all know that we don't see this symposium as a one-off event, but it's really an event that sort of adds to the momentum that's already going on in motion in the city and really sets forward a concrete plan that we can work on for the next several years. So again, I want to add my thanks to the outstanding panelists, moderators, all the participants in the program. I learned so much. I can tell you, I thought about 3 things, 3 P's and 3 R's, actually. I heard a lot about people, really valuing people. I heard about some very impressive programs. I heard about the importance of policy. So, and then I thought about 3 R's as well. I heard a lot about respect, respecting and valuing the diverse perspectives and talents and strengths that we all bring to solving these problems and to advancing health equity. I heard about the importance of relationships, really building relationships between communities and those who are working with them on these issues, as well as building relationships among us, those across different sectors. And then I heard about, I mentioned respect and relationships, resources. We really do need to invest in what is most important to us. If we say that our people and the health of our people are the most important things to us, then we really ought to be investing resources in those things. So I had tons of other ideas that Lauren and the panelists captured so beautifully that I'm taking away from this. Really, again, that whole idea of amplifying voices, of building skills and capacity, of fixing systems and not people, of using data and evidence to inform our work, of creating supportive environments and having leaders who actually set the tone for that, valuing and seeing health holistically. It's not only about a physical condition or not only the absence of disease, but really a sense of really true wellness and quality of life, that we really should be thinking about life across the entire life course. That we should be proactive and not reactive. And then finally, another really important thing I think is that it's not a zero-sum game. Just because we make a decision about one thing doesn't mean that anyone else has to lose. We can all actually win when we work to advance health equity. So those are my thoughts and remarks to close out the day. Again, please stay in contact with us. Sign up for our newsletters, visit us on our website, complete the survey that you get to tell us how you liked this program and how we can improve it moving on in the future. And again, thank you to the artists for the beautiful presentations and sharing your gifts and talents with us. Have a wonderful and healthy weekend, and continue in the struggle.